Meningitis. First of all, I'm going to talk and explain a little bit of what is a meningitis. Meningitis is usually caused by a viral infection, although it can also be bacterial or fungal. Vaccines can prevent certain types of meningitis. Symptoms include headache, fever, and a stiff neck. Depending on the cause, may get better on its own way, or it may be severe and require urgent treatment with some antibiotics. Now we have some types of meningitis. The viral, that is the most common type of the bacterial, which is the most contagious and is caused by a certain kind of bacteria. The fungal, that is the most rare type of meningitis, and last we have the parasitic and the non-infectious. Now I'm going to talk more about the symptoms of the meningitis. We have symptoms like a high temperature, cold hands and feet, vomiting, confusion, breathing quickly, muscle and joint pain, pale mottled and blotchy skin, and spots of a rash are some kind of symptoms, the most common symptoms that it can be present. Now it's turn of the treatments. As we said before, depending on the cause of the meningitis, it will get better on their own way, or it will need to be attended by some urgent treatments and antibiotics. The bacterial meningitis is treated with the intravenous antibiotics. There are no specific antibiotics for bacterial meningitis. It depends on the bacteria involved. Fungal meningitis is treated with antifungal agents that are the most common and the most known type of treatment that you can receive. The region of the meningitis. The first definite description of the disease was by Besius in Switzerland in 1805. The bacterium was first identified in the spinal fluid of the patient by Switzerland in 1887. Neisseria meningitis is a leading cause of bacterial meningitis and sepsis on the United States. How it spreads? People spread meningococcal bacteria to other people by sharing respiratory and throat secretions like saliva or spit. Generally, it takes a close, for example, coughing or kissing, or lengthy contact. To spread these bacteria, fortunately, they are not as contagious as it was before. The consequences: untreated meningitis lead to a coma, poor coordination, illness, and clumsy by remain. Sometimes after a bout with the meningitis, children may have emotional problems following the illness, including illness, moodiness, and sleep distress. People prone to contagious. Among teens and young adults, those are through 16 to 23-year-old have the highest parts of the meningococcal. This is anyone can get the meningococcal. But rates to disease are the highest in children younger than 1 year old, with a second peak in adolescents. Who discovered the meningitis? The first report of bacterial infection on Darling meningitis was by the Austrian bacteriologist Anton Weichwolf, who in the 1885 discovered the meningococcal mortality from meningitis was very high, over 90% in early reports. Parasite effect: the pain area is the neck, the back, or the muscles. Whole body, it presents the fever, chills, fatigue, lethargy, malaise, loss of appetite, or tremors. Gastrointestinal is the nausea or the vomiting. Skin, you will have some red rashes also. Now you can have confusion, stiff neck, irritability, sensitivity to light, headache, lack of true interest in feeding babies, the fast heart rate, slowness, fear of loud sounds, rapid breathing, or blood sickness. Some diseases are similar to the meningitis up to age 5. The disease most often suggests meningitis were right side, subidum, and orthodontry infection. The safety measures to the meningitis are that you can wash your hand carefully. The hand washing helps you to prevent the spread of the germs, and you will be more secure for you and your friends and your family. Wash your hands carefully is the most important thing you can do. Practice a good hygiene. Don't share drinks, food, straws, eating utensils, or bombs to the treasures with anyone else.